Hi, I'm Dr. Narinder Dew, and this is Dr. Nicholas Wyatt, and we are co-founders of Synergy Therapeutics, the evolution of nature, the revolution in science, and the dedication to optimizing health with supplements that are powered by nature and proven by science. Sure. The pulse dose therapy of vitamin D3 of 10,000 international units, which is contained in a D10 Synergy Therapeutics formula, is based on the science of looking at vitamin D more as a steroid or a hormone as opposed to a vitamin. By strict criteria, a vitamin is something our body doesn't produce. We produce vitamin D in our body provided we have sun exposure. But all hormones are pulsated into the human body in terms of they have a high maximum dose and then they get filtered down. And we have a fail-safe mechanism for negative feedback for the vitamin D. Therefore, D3, this form that is the storage form, is the correct type of vitamin to replace in the human body. It has to be pulsated with a high dose of 10,000 international units once a day, and thereby then be converted by the liver and other genetic processes in the body to the active form of 125. At each step of the activation of the vitamin D in the human body, there's a fail-safe mechanism for negative feedback, and that's exactly how hormones work in the human body. They're pulsated into the human body with a high dose, and then they're activated accordingly to the human body's needs. This type of pulse dosing can only be appreciated by giving a magnitude of 10,000 international units once a day. We have not only made this hypothesis, but we've proven this by showing in our patient population, by doing hundreds of tests in our patients, that we can quite easily achieve the therapeutic levels of 70 to 120 nanograms per mil by giving a 10,000 international unit dose of Synergy Therapeutics D10 formula. And this is the appropriate dose based on the world literature.
That's another question that we get is, well, I go out into the sun all the time, I don't need vitamin D. Our patients commonly say that. And it's very important for the consumer to understand that if you're going to get your vitamin D source from the sun, one, you have to be out during the hours where you get UVB radiation from the sun in order to actually make vitamin D. The second thing that a lot of consumers don't understand is the fact that when you go out into the sun, you've got to wear minimal clothing. So I always tell my patients that if they're going to go out into the sun in either a two-piece bathing suit or a Speedo, that it's more than fine. They probably would, during the summer months, get their peak vitamin D intake. The problem is we don't do that. When we go out into the sun, we wear long sleeve coats or long sleeve shirts, pants, we cover up our faces, we wear sunblock, and in reality the average American only spends 5 minutes in the sun anyways. And so that's not long enough. In about 20 minutes, 20 to 30 minutes, based on your skin pigmentation, your body will produce anywhere from 10,000 to 20,000 international units. Realize if you're darker skinned, then it's going to take a longer period of time to produce that same amount of vitamin D. And so that's why Dr. Dougal and myself chose the vitamin D 10,000 international units, is because it's exactly what Mother Nature does for you. You go out in the sun, it gives you your daily dose of vitamin D, you feel better, you're protected, and that's that. And so we gave the 10,000 international units with the same intention of what Mother Nature has. Yes, in certain parts of the country, it's very likely that even if there is sun out and you're receiving sun rays, that you're not receiving UVB rays due to the tilt of the axis. And so if you take a line, or take a ruler and lie it on Los Angeles and draw the line all the way across the United States, you'll find that anywhere above that line, or the 35th parallel, you'll realize that in the winter months, from about November until March, April timeframe, even if you're getting sunlight, you're not receiving UVB rays due to the tilt of the Earth's axis. So you aren't making vitamin D. And so that was the theory behind that. In the summertime, your vitamin D levels went up, and so you could make it through the winter time and would not become deficient. But because of our lifestyles now, the fact that we aren't out in the sun because we're no longer hunters and gatherers, we don't do that anymore. And so that's why it's very important for you to supplement with vitamin D, not only throughout the summer months, but especially everyone should supplement with vitamin D10 throughout the winter months to ensure the appropriate amount of vitamin D intake. Thanks for joining us on Synergy Therapeutics YouTube channel and some great discussions about the products that Synergy Therapeutics offers. Again, I'm Dr. Nicholas Wyatt and this is Dr. Narinder Duggal. And remember, Synergy Therapeutics offers the only products that have been powered by nature and proven by science.